this week is Transgender Awareness Week. I'm going to make a couple of videos in line with that. I have my Epic t-shirt on. So today is the first of two videos I'm going to do this week. But I want to talk about how, by people that don't understand what it is to be transgender, they either kind of think this is a mental health issue, a mental health condition, a disorder of thought, or it's a lifestyle choice. So obviously with those views comes a lot of discrimination and a lot of misunderstanding. I've found this recently in getting my lower surgery funded. There's been a couple of people that have questioned how I'm allowed to do this on the NHS. Well, the reason I'm allowed to do this on the NHS is it's because it's a valid medical condition. Being transgender is a valid medical condition. At one point, it was classed as a mental health disorder. That was taken out of the Diagnostic and Statistical Manual in 2012. We used to have to get the diagnosis of gender identity disorder in order to get the treatment we needed. But understanding of being trans has come much further forward since then, and it's recognised now that being transgender in itself isn't a mental health issue. It's not something that's in our minds that we just think we're male and what have you, and like psychiatrists and doctors are pandering to our needs. This is not a disorder of the mind, this is a disorder of the body. And so it was changed from being disorder to gender dysphoria. And this recognises that being trans in itself is not a mental health diagnosis. But what often happens with people who are not comfortable in their bodies is they experience dysphoria, which is huge anxiety, depression, self-harm, suicidal thoughts. And it's recognised that this dysphoria is in itself still warranted of medical treatment. So by changing it from disorder to dysphoria, it still recognises that this is a medical condition that needs treatment, but it removes the condition from being inside our heads to one of needing outside help to change our bodies. Does that make sense? This is also reflecting much more. I'll move forward in medical research as well into how people become transgender, how it happens that we're born and our sex characteristics, that is the parts we own. It's unfortunate they're called sex, it gets confusing when it's sex and gender. The parts between our legs and the parts inside are often what determine us as male and female. But for a lot of us, me, when we're born and we're looked at, they see parts and assign a gender based on those parts. And for some of us, those just do not match. And we don't know why. That's the absolute truth. We don't know why, and it's hard to actually pin down why. The current understanding is of a kind of brain intersex, whereby in the womb, a baby will get a shot of, say, testosterone, which will masculise the brain. But then it should get a second shot of testosterone, which then masculises the body, and this doesn't happen. So therefore you get somebody that's born with a gender identity in their brain as male and a body that looks, for all intents and purposes, as female. Now, although there's a lot of evidence, and I'll put some links down below to show this, of course you can't isolate a human being, so you're even affected by the social environment when you're in the womb. So you can't isolate this cause and effect. Obviously when you come into the world you're affected as well. So it's very, very hard to prove these things. But from my own personal experience, you know, this goes beyond just wanting to play with different toys and wanting to play in a bit more boyish manner. It's not about stereotypes, it's about this deep feeling to the very centre of my bones that I'm male. We all know ourselves as we are. We do absolutely know who we are. You know who you're attracted to. You know your internal world. And I know I'm male. So yeah, we're getting a much more accurate view now of trans people as not disordered, as having a valid condition, which means they have experienced extreme dysphoria manifesting in anxiety, depression, because their identity does not match their body. Okay, so I think when people understand this, they'll be much more likely to be supportive of us. But I think the problem is, in saying it's not a disorder, is then you're still getting people that are being sent to psychiatrists. Now this has all changed a bit in the gender identity clinic system You used to get go to your doctor, explain you're having gender issues, you'd then be referred to a mental health professional who'd then refer you on to a gender identity clinic. They've scrapped that now, which has helped. But people are still going to specialist clinics to be assessed by psychiatrists. So if you want to remove the idea of this being a mental health condition, why are people being psychopathologized and sent to psychiatrists? Yes, I know we need to be checked that there isn't something else underlying it, but you don't need 10 million different checks by psychiatrists. Once you've been assessed once and it's recognised that yes, this person has gender dysphoria, yes, this person is transgender, I don't see why we need to keep having those interventions. If someone needs support, then great. If not, what are we doing? Because it's no wonder that children who come out to their parents are often thrown out or told they're going through a phase or misunderstood, because if these parents look at the treatment and see that they've got to be sent to a clinic, this then just perpetuates the view that in some way their children are mentally disordered, mentally disturbed, having thoughts of that are wrong. We need to reflect in the treatment for transgender people the fact that it is a medical condition. Send people to hospitals where you would send anybody for a medical condition, rather than to a special little clinic of which there are only a few in the country and huge waiting lists and hoops to jump through with psychiatrists. It doesn't work anyway, this psychiatrist thing, because people just try and tell them what they need to hear. We need support. But you're not going to get a proper support because people are too scared to tell the truth because they see these people as gatekeepers. I'm waffling a bit now because I get quite passionate about this because it is something that worries me. I know that there's nothing wrong in my brain. I am transgender from no fault of my own. My brain developed differently to my body, and it's not a choice either. It's not like I woke up one morning and went, do you know what, I'm really bored, I'm going to put myself through a few years now of cross-sex hormones and painful surgery because I'm just a bit bored with my life. You know, that doesn't happen. So yeah, I had this experience a couple of times recently with my surgery where people have kind of questioned and then said, I really support you, I really, really do. I just think it's wrong that when the NHS is struggling that you're being funded. So on the one hand, these people are really, really supportive of what I'm doing, but because they're missing the point, they're seeing it that this is a choice some way. And I haven't got a choice. My choice is to live with humongous, painful gender dysphoria, which is going to kill me. You know, I've been clean and sober 5 years, by the grace of God. But if I hadn't been able to transition, I would likely have relapsed. I would likely have committed suicide. That's the truth of this matter. This is a serious life-threatening illness, the same as any other diagnosis. This is not a choice, this is not a mental health condition, this is something that's incredibly painful and takes lives. It's 41% of transgender people attempt suicide. The use of drugs and drink and self-harm is huge because of this condition. So, you know, I just want to really stress that this is a valid medical condition. It is not a disorder of the mind. We're not messed up in some way and imagining we're men when we're not, and vice versa. And neither is it a choice. You know, so we just need to have that reflected in the treatment we get and in the programmes we see on telly. The one a couple of weeks ago was quite appalling on Channel 4, and they said this awful thing that just made it look like a choice. It was girls across Britain are becoming men, and we're not becoming men. We are already men, but we've been born into bodies that do not reflect that. So yes, it's early days and I know that it's going to get better, but the more people that say this out loud, the better. We need proper care that reflects the truth of our situation and our experience. So yes, I will stop waffling and get off my soapbox and leave it there, and I will put a more light-hearted video about Transgender Awareness Week on Friday. So I will see you then. Thank you for watching and have a really good Wednesday.